As Maya Angelou once said, life is not measured by the number of breaths we take, but by the moments that take our breath away. We are gathered here today to inform you about cystic fibrosis. Knowledge of cystic fibrosis is extremely important since it is a worldwide known illness that affects children and teenagers. My good friend from high school was diagnosed with cystic fibrosis when she was a kid. I'm going to talk to you about cystic fibrosis and who is affected, body parts that are affected, symptoms, and treatments. One must simply understand what cystic fibrosis is and who or what it targets. Cystic fibrosis is an inherited disease and is commonly diagnosed within children or teenagers. An autosomal recessive gene causes cystic fibrosis. This was discovered by doctors after running many tests on families with cystic fibrosis. Certain tests can include gene test and blood test, and they're able to detect whether or not someone has cystic fibrosis. Cystic fibrosis is caused by mutations on the CFTR gene, which provides instructions to make a protein that channels salts across membranes. Typically, when a gene is autosomal recessive, it essentially means it needs exactly 2 copies of that same gene to occur on any chromosome. Cystic fibrosis is such a rare disease, only about 30,000 Americans have the disease. Approximately 70,000 people have cystic fibrosis worldwide. Doctors may question if a patient has cystic fibrosis based on a large variety of things. Children and teenagers can show many different symptoms, along with having positive blood and gene tests that can determine whether or not someone has the disease. The parts of the body that are affected from cystic fibrosis are the lungs, the pancreas, the liver, intestines, and several other organs. Obstruction of the lungs increases the risk of infections such as bronchitis and pneumonia. Cystic fibrosis obstruction of the pancreas can lead to malnutrition and poor growth. There are many different symptoms in a person that has cystic fibrosis. These are including salty tasting skin, coughing, shortness of breath, poor growth and poor weight gain, repetitive lung infections, and several other symptoms. The thick and sticky mucus associated with cystic fibrosis causes the tubes that carry air in and out of the lungs to clog. After diagnosing someone with CF, family members monitor the symptoms to ensure proper treatment occurs. This right here is someone that has clubbed fingers, which is also a symptom of someone that has cystic fibrosis. As you can see, the difference in the fingers. Treating the symptoms of cystic fibrosis can promote a longer lifespan and can provide a much more enjoyable, painless lifestyle. Cystic fibrosis does not have a cure, but the symptoms associated with the disease can be treated. The treatments have changed greatly over the years. Treatments can include a combination of the following therapies, such as airway clearance, inhaled medicines, pancreatic enzyme supplements, an individualized fitness plan, and CFTR modulators. Patients that have CF may be prescribed antibiotics, bronchodilators, or mucus thinning medications. These medicines help treat and even prevent lung infections, reduce swelling, open the airways, and thin the mucus within the lungs. Injections of normal genetic makeup have been placed into the airways that are filled with the affected CF cells by doctors and other scientists. Using medicines and other treatments can subside the symptoms of CF and prolong life. The average person can live to approximately the age of 37, but some can live up to see the late 40s as long as they treat the illness and the symptoms that can possibly arise from it. I hope this gives an insight on cystic fibrosis and how it affects children and teenagers' lives. I shared with you what cystic fibrosis is and who or what body parts are affected, symptoms, and the treatment process. As Rob Bell once said, the breath that you just took, that's a gift. Thank you, everyone, for watching.